Hello, my name is Don Pelto. Welcome to Podiatry Practice Mastery, where we're helping you take your practice to the $1,000,000 mark and beyond in personal production. I had a question from a doctor the other day. They said, "Hey Doc, hey Don, do you have your Shockwave resources you can send me?" I've been discussing the last few days about Shockwave. We have, as I mentioned before, we have 2 radial machines. We have a focused, and then we have a soft wave. And I'm kind of a note taker, so every time I go to these conferences and get different ideas, and I like to think about marketing ideas, I put them into a notebook. If you haven't heard of it, it's kind of neat. It's called Notion. And it's kind of like Google Docs, but it's a little bit better, in my opinion, for taking care of this. Actually, Google Docs are getting about the same now, I think, because with Docs, you can now open tabs within the Docs. So you could go deeper, like different tabs within each, kind of like Google Sheets, like Excel. You can have multiple sheets. You can have the same thing with Docs. But anyway, I haven't transferred it there. It's still on that. So if you want my resources, you can either send me an email, don@podiatry-practice-mastery.com, or at the Podiatry Practice Mastery website, all the way down on the bottom on the footer, it says Shockwave resources. And then there's like different types of videos. There's that link to that Notion page and things like that. You can get it all right there. But I'd be happy to send it to you or answer any other questions, because that gives me fodder for this podcast. So the question I got yesterday, a doc reached out to me, and he said, "Hey Don, I have some questions for you about your urgent care." So it seems like it's something that's there's more questions that people are having. So I'm going to try to be efficient here and answer some of the most common questions that I get, and some of the common questions that I had for doing this urgent care. So first of all, is my clinic truly an urgent care clinic? I guess it is. So if you look at all these urgent cares that are popping up, they are only open certain hours. They're not like an emergency room, right? They have their hours usually from 8 to 5 or 8 to 6. And then they're able to see all types of condition. Now, mine is a podiatry-specific urgent care. When you usually go to the urgent care, you don't normally make an appointment. You just kind of show up and wait. We decided not to do that because it would just be chaos, and we don't have a huge waiting room. So we do not do it that way. What we do have is we have an online booking schedule where patients can pick out slots. We use ModMed, that's what we use, and they have something called Clara, which is kind of like an online, you can make appointments, and so you can make filters in your schedule. So normally our filters used to have new patients and then established patients. So new patients, it's obvious, that have never been to see us. Established are those that haven't seen us for, or people that haven't seen us over 3 years, right? Established patients have been here before. And then urgent care patients, we have another category. The neat thing about urgent care in the way we set up our schedule is that urgent care can take new or established locations in our schedule. Why do we do it that way? We did it in that way because it was confusing to patients if they're new or established, first of all. And the urgent care, it kind of distinguishes in our schedule what are urgent care. And third, I think urgent care patients tend to be a little bit easier to deal with, meaning we could fit those into a new slot or an established slot without messing up the office flow. Yes, most of the time they need x-rays, but that's pretty easy. But it's not like they're not normally like a first-time plantar fasciitis patient, which might take a long time. And we can also just triage it and do it a little bit quicker. So it really hasn't messed things up in our schedule for adding these. Now, another question is, how are you able to do this if you're busy? Well, the established doctors, so we have 4 doctors in the practice. 3 of us are pretty established, have a pretty packed schedule. We have 1 doctor that is newer, and he has a lot of openings. So the real benefit of doing urgent care, in my opinion, is it's filling up his schedule and giving us a little bit of overflow. That, like, if they're looking for us, they're going to try to pick out our times, right? If the patients already know us as the doctors. But if they don't know us, they're going to take whoever's available, and he has a little bit more availability in his schedule. So how long can I do this? Now, once he gets totally packed, right, once we're all producing at the same level, I might not be able to keep that same offer, seeing you within 24 to 48 hours. Okay, that's I won't be able to do that. And also someone asked, well, urgent care tends to have like a regular copay, like a primary care, I think it does. And we're a specialist, so that means our copay is a little bit higher. Do we have like a copay like urgent care? We don't. We're just using it more as a marketing thing in our office. Like one of the big reasons I decided to do this is because we wanted to market to get the new doctor busier, and I didn't have a great way. And not that I didn't want to advertise him. I'm okay with him, but no one knows who he is. And that's going to take time. But the urgent care, everyone wants things faster. Everyone wants, that's just the way that we are. We want Amazon faster. We want to see a doctor faster. And so if we can get patients in and give them good care, that's a reason. And then kind of one of the other reasons is that I was seeing a ton of patients, not a ton, maybe one or two a day. They were referred from the urgent care. For example, they would go to see them. They gave them an x-ray, gave them a cam boot. And then when they saw me, I got new x-rays and I told them they didn't have a fracture, so they didn't really need the cam boot. Or they would come in, they got antibiotics, and then I had to do the ingrown toenail because they couldn't do the ingrown toenail. So this happened over and over and over again, and I was thinking, this would really save patients money as well because they don't have to see the urgent care. They can just come and see us, and we can do all the same thing. Okay, so that's kind of like version 1, what I'm working on. So if you have other questions more than that, you let me know. So we do it. The appointments. We have an urgent care page we made, so you can go to my website, centralmasspodiatry.com. You can certainly copy mine. A number of people have copied mine. You can Google urgent care podiatry. You'll see some. There is a gentleman in Boston. He has one as well. It's a neat idea. I think there are some marketing people that are using it to generate leads, like urgent care, and they'll sell you those leads. And so we're doing it that's number 1. Now, how do we get the word out? Currently, we're doing $5 a day on Facebook ads. So I made an ad, and I'm sending patients to that urgent care page. That's how I'm kind of marketing it. And then as it gets better and better, we can ramp up that marketing. And then what I haven't done yet, so I'd like to know if anyone's really good at this, you could help me. I want to make a postcard size postcard, I guess, something that says urgent care. And I'm still not undecided if I want to make it like our practice specific, or they can just say podiatry urgent care. And I'll tell you the reason. So I'd like one that I can give out to all of my patients and just say, hey, if you have friends or family with urgent foot issues, send them over. So it's an urgent care thing. I can give it out to every single patient, have it at the checkout. Okay, that's one thing. Number 2 is I'd like to give it to like shoe stores, physical therapy places, other places like that, so they can advertise the urgent care. So at those ones, I'm almost thinking about doing a generic urgent care with a link certainly to our website, but I don't know if I want to advertise our practice. And the rationale for that is they also have a lot of other podiatrists that refer to their physical therapy clinics, their shoe stores, and other things like that. So I'm thinking about almost doing just like a direct response one. That's a marketing term to get patients talking about podiatry urgent care, and then maybe even put together a booklet. I'm a big kind of a book because they're easy to make PDFs. You just open Google Docs, make a nice document. You can even use ChatGPT and then put a nice cover, and you got a PDF. So making like a PDF of like what are the top 10 urgent care conditions and how to treat them before going to the urgent care or something like that. So a little thing like that they can download that would get their emails, right, number 1, but it would also give them information if they're not ready to come in yet. So those are kind of the marketing techniques. That we can give those same urgent care cards to the primary cares, and you can kind of just spread them all around. So that was the second thing that I'm kind of working on. And then the third thing I think it would be fun would be, and these are just, this is how my mind works, is I was thinking, well, could I go to the urgent care and actually do like an in-service for them to help them to get better? And I know this might sound like you're shooting yourself in the foot, and I still remember I used to make YouTube videos of like ingrown toenails, and I've had doctors say, hey, Don, you're like giving away all of our secrets. Aren't they going to try it themselves? And no, they're not going to try it themselves. Some people will, but the majority of people won't. They just want to learn how it's done. And I feel like the urgent care, by educating them, they would send more of those patients to us. And I could do like the top 10 podiatry urgent issues and how to treat them. And I could go there and kind of help them, but they're not going to do their own ingrowns or matrices. And anyway, if they want to try, that's fine, but they'll send over the other ones anyway. So some people, I think that they're kind of insecure, and they're like, I can't give away anything or teach anything. I think that's that's just my opinion. I think that's very restrictive. I think by helping others out, they are going to indirectly or directly refer a lot more patients. So kind of putting together like a workshop at an urgent care, stop by for a half hour, say, hey, let me share what I've seen, kind of give my you've been sending a lot of people over. This wasn't a fracture. This was like an ossicle at the fifth met base. You thought it was a fifth met base fracture. Hey, if you want me to look at any of your x-rays, just text them over to me. Give them my cell phone. Text me some of those x-rays that you're unsure of, and I'll take a look, and I'll fit these in. And by the way, we have our own little urgent care here. If you need to get them in, we'll get them in, priority access for you. So anyway, those are some of the urgent care questions that I think people might have. Okay. So for the day, this was I came in a little bit late today, and I don't know how you guys do this. I used to have Mondays off, and I used to be able to do all of my doctor appointments on Mondays, but now I don't have Mondays off, so whenever I have doctor or dentist, I have to come in a little bit late. That's kind of one of the reasons I miss having a day off. I was like putting on my office visits. So I went to the dentist. My teeth are descaled, so they're good now. Okay, so there's a shorter day. So the first patient was a 10-year-old female. She had cantharidin, and she is getting better, and I'm going to have her follow up in about 1 month for the cantharidin. Okay. The next patient was an 8-year-old female. Actually, these were two sisters. She also got cantharidin. And what I asked is that when they come back in 3 weeks, they are going to have the same appointment. So I sometimes do this for efficiency. Like if there's 2 warts and I'm putting cantharidin on them, I'm just going to see them on the same slot. So save time. Next was a 58-year-old female who had right posterior tibial tendinitis or tendon dysfunction only on the right, and then a right second hammer toe. This patient had previously had orthotics by a chiropractor, was sent over from physical therapy, and this one I did like the night splint, foam rolling, morning stretch for the posterior tibial tendon. And I talked to her about orthotics. I think she's going to need more of a custom one because she had these foot levelers, which tend to be the ones that the chiropractors do around here. And I think ours are better than those for correcting the posterior tibial tendon dysfunction. I talked to her about a brace. She's going to consider all the treatments, and then I asked her to come back. And if that, because she's not really having a tendinitis, she's just having that foot dysfunction. But I did spend most of the time teaching, and I gave her some resources on our website. So the way I do resources, I haven't talked about this for a while, is I use something called Patient Education Genius. So I send them an email or a text message with a link to our website, and and then they get a link to that with that patient education information. And then sometimes I always use my treatment sheets as well, where I give those out as well, which has links with QR codes. Next patient was a 71-year-old man. He had right plantar fasciitis. This guy was on an urgent care visit. He came in a couple weeks ago. Urgent plantar fasciitis. I'd never seen, I don't know if I said never seen, but he had really bad plantar fasciitis. I had to do 2 cortisone injections, one in the plantar medial heel and one a little bit more in the arch. And I put him in a cam boot and gave him meloxicam, icing, contrast baths, things like that. He is feeling so much better. He actually has no pain right now. I don't know how long it'll last. I kind of pre-warned him that potentially the cortisone could wear out, but he is feeling great. I'm not going to see him back. Next was a 40-year-old man. He had bilateral nail fungus. I did LFTs and my fungal kit. That's what I did for him. He's going to come back in 3 months. Next was a 45-year-old female, left plantar fasciitis. She had Shockwave number 1 out of 6, so started that. Next was a 67-year-old female. This was the morning. Now the afternoon. Right hammer toe. She had a thick nail, so basically a second digit hammer toe causing that thickness in the nail. She had a couple of others that were thick. I debrided them, offered terbinafine. We talked about nail fungal treatment. She wasn't really interested in any of that. So this specific case is when I use something called Cara Nail Gel, which is a 42% urea gel on the toenail. I taught her how to use it. She's going to do that to soften the nail. And then she's going to come back to see my nail tech in 3 months to trim those nails because she liked having that done. Next patient was a 25-year-old female She had 2 nails that were thickened, and I did, so she was a new patient, so I do an office visit for this. I debrided the 2 nails, so I got nail debridement due to pain. Then I did bilateral Cariflex, and she got the kit. So, if I do 2 Cariflex, it's 125 plus 50, so 175, plus the kit, which is 75, so it's 250, and then the debridement and office visit. So it's pretty good in terms of revenue. There are other things that are much better, but she was really happy about having this Cariflex done. And then there was another patient towards the end of the day, same thing. She's a 33-year-old female. She had acrylics done in the past. So her nail tech had tried to do acrylics, and they kind of, they're so rigid, they pulled off the toenail. So on her right side, she had no nail. On the left, she had a nail, just a stub, and the acrylics just weren't working. So I talked to my nail tech about this. The difference between acrylics and like Cariflex is that it's a little bit softer and it's a little bit more flexible. And so it's like a builder gel. I'm still learning about that. I don't know all that this nail stuff. And frankly, some of you just might not like to do this stuff. None of the other doctors in my office like to do Cariflex. They think they're being a nail tech, and they would prefer just to cut bunions and do surgery. But I have to tell you, this is like the only thing that makes my female patients cry. They come in with no toenail, and they leave with a nail, and they really like it. Now, this other one that I did that had the nail pull off, I think she only had skin there, so I really forewarned her. I said, you're going to pay for this, but this is probably going to fall off, because you usually have to have some type of nail. It takes a little finesse to learn how to do it and make it look good. I'm trying to send Olive my nail tech, but it's not working too well, as you can hear in my little rant every day. Next patient was a 58-year-old for right plantar fasciitis, a female. She got my Pelto special, night splint foam rolling morning stretch. And then I sent her meloxicam. This is the first patient I've ever had. She used an Amazon pharmacy. I think that might start to be a thing, but Amazon is ruling, and now they have a pharmacy. So, I wonder what's going to happen to all these other pharmacies. Next was a 48-year-old man of number 5 out of 6. He had ankle and subtalar joint bone marrow edema. He is starting to feel better at week 5. Now, we did a kind of not even a test, but he had Softwave last week, and he had focused Shockwave this week. The Softwave he didn't feel as much, and the focused he felt much more. I really had the Softwave cranked up. I think it's because that big head on the Softwave machine, it's harder to get into these crevices, into the subtalar joint or sinus tarsi in that area there, where I was doing to hit the bone marrow edema that he had that showed up on the MRI. So in this specific case, I think the focused was a little bit better for this gentleman. Next was a 78-year-old female that left, a male that had a left fourth toe fracture and a little gapping between the first and second Mets. So I ordered an MRI for possible Lisfranc, and I put them in a cam boot. And I'm going to see them back after the MRI. Next was a 17-year-old man that had low tone. I gave him an orthotic. He also had a porokeratoma. He was walking more on his toes, which developed this deep callus, so I did lesion destruction for that. And I think that's what was happening. And then the last patient of the day was a 59-year-old man with right plantar fasciitis, did number 2 out of 6 out of Shockwave. I want to tell as well, there was a patient that one of my colleagues sent over. He sent me over a patient with a little lesion on the lateral plantar foot, a dark lesion. I biopsied it. He sent over specifically for a biopsy. Came back as malignant melanoma. So I know we kind of all have these, but this was a good catch. I did 2 2-millimeter punches, came back as melanoma. I referred it directly over to a surgical oncologist that I know. I don't particularly remove these. I don't feel comfortable. I just don't do a lot of them. But it was a good catch, and I did also call the primary care. So I think those are, the dermatological things specifically. I think we should be doing more biopsies. I think sometimes we get busy, so you have to have a really clean system. And so I'm just going to reiterate my system for biopsying. I basically have a little button in each treatment room that triggers my staff, or I open the door and they can see me. I just say I want one cc of Lido with epi, and they get that. And then I say, okay, now give me the consent, and they'll do the consent. While they're doing the consent, I'm going to numb it up. It takes actually 10 seconds, and I'll do 2 punches. I have these 2 millimeter punches in my in each of the treatment rooms, and along with these little containers with the formaldehyde in there. And I think it's saline, and I punch them, put it in there, and then I put their name, each patient, each door. I know it sounds kind of funny. I don't know if you have a better way, tell me, I'd love to know. On each door, they put a sticky note with the patient's just first name and what they have going on to not break HIPAA. But I put that sticky right on the container so I don't have to fill out the container and nothing's lost. So I do that for my nail samples and also for my biopsies. I just take that little sticky and put it on there. I used to try to fill it out, but no one could read my writing, so I just use their thing, and they'll do that later. So it takes literally like 2 minutes to do a biopsy, and I put a gauze and a Band-Aid on there. So I'm glad I did it for that patient. I think I don't have patients ever come back for a biopsy unless it's a nail biopsy. I always do it the same day. Anyway, hope you guys found that beneficial. Once again, I am, if you noticed, I've some of the older episodes, I went back and made new SEO advanced titles, and I put in new descriptions. So let me explain. I've been trying to improve the podcast, and one of the things that I'm learning about, I should have good titles and good descriptions. And usually I was just too busy just to get them done and not have it done. So how did I do this? To do bulk podcast edits. I don't know if you guys like this stuff. You might like this, but so what I did is I went to Fiverr. I use Fiverr a lot, or I used to use it a lot. That's what I'm going to actually use to make this postcard is Fiverr. So I just tell them what I want, and like for a postcard, but in this case to edit the SEOs. And I went back and forth with a couple people. I put an ad out there. Hey, I need someone to do like 800 episodes of a podcast for like no money for $10, which didn't work. And a couple of people got back to me. Like one wanted to do it for like $500 to do like 10 episodes. I found this other gentleman that was willing to do 200 episodes for $1.50 a piece, which I think is worth it. When I do it myself, it takes me 3 to 5 minutes. And everyone has to make their money. And he also, he was like in Africa, and he wanted access to my ChatGPT. So I did a ChatGPT Pro account for like a business account with 2 people. And so for me and for him, it's like, instead of $20 a month, it's like $30 per person. So and they say I guess it's maybe a little bit better. And so I did that for him. And then I paid him $300 to do 200 episodes, based on the transcript. So what he's going to do is he's going to get the transcript. The way I was thinking, he'll probably may have a better way. He gets it from YouTube, because my podcasts all go to YouTube as well automatically. So he'll get the transcript there, copy it, paste it into ChatGPT with a request for like a SEO ranked title and description, and he'll copy and paste those into my Spotify where I do this podcasting. So he's going to do that for those episodes to get kind of higher ranking. But once again, you could help if you are liking the things that I'm doing. Share it with your friends, or just put a little comment on there. That would help this grow, so other podiatrists can learn about it, because very few people listen to it, and I think there's a lot of good content for people that are in private practice. Okay, talk to you guys next time. You might be getting emails about, I'm putting together a 6-month challenge. If you are interested, shoot me an email, don@podiatry-practice-mastery.com. Happy to share it. It'll help you get with some hand-holding and kind of getting with a group of colleagues to get your practice to the $1 million mark. It's hard just to listen to stuff. I think it's better to be in a group for implementation. So that's what I'm putting that together for. Okay, talk to you tomorrow.